Hello and welcome, everyone. My name is Caroline McGraw, and I'm part of the wonderful team at The Clearing. And today we're going to talk all about anxiety and addiction. So I want to start by reading you a quote from a person who, like millions of Americans, struggles with anxiety on a daily basis. And it goes like this: "My anxiety is silent. You wouldn't even notice a change on the outside. But I'm honestly so stressed, I can't even manage simple tasks. People call me lazy, when in reality, I'm just overwhelmed." So again, that's just one of the millions of Americans every single day who are struggling with anxiety. And in our program, we define anxiety a little bit differently than the traditional definition. We define it as emotional energy that is bouncing back and forth, trapped between our internal walls. So we'll dive into that in a little more depth in a second, but just keep that in mind. Think of anxiety as kind of like an internal pinball game, an energy that's bouncing off of internal walls. So that definition brings us to the most important point about anxiety, which is that long-term healing means a lot more than just relaxing. So we're wholeheartedly advocates of meditation, mindfulness, and relaxation techniques. But what really changes your felt experience of anxiety over the long term is addressing those emotional issues that are at the root of it, addressing what's behind those internal walls. So also want to do a quick note about medications here, because we get a lot of questions about, are you going to want me to go off of my medication for my depression and my anxiety? That's the one thing that's keeping me going. I don't know what to do about that. So in the short term, medication might very well be the perfect fit. In the long term, though, we really encourage people to address the root causes, not just work on alleviating their symptoms. So again, medication can be a really important bridge, especially if you're in a crisis point, and it can help get you from a dangerous place to a safe place. And that's a beautiful thing. Yet it's also really important to look at some of the dynamics and the stressors, the judgments, the limiting beliefs that are contributing to your anxiety over the long term, not just in the crisis. We just really think it's time to treat mental health conditions rather than just medicating them and hoping that they will disappear. So going back to our definitions, if anxiety is emotional energy that is bouncing back and forth, trapped between our internal walls, well, what does that have to do with depression, which is so inextricably linked with anxiety? Many people who have depression also have anxiety and vice versa. So if you tuned in for our last Facebook Live, What's the Deal with Depression and Addiction, then you know that we define depression as anger turned inward. Anger turned inward. And I'll put a link to that video in the comments section in case you haven't seen it and you want to go more in depth on that. But I want to explain a little bit about how this dynamic works in our bodies. So when you turn your anger inward and you refuse to feel it, the result is that you create this internal wall and you start to feel cut off, disconnected, and numb to your feelings, which is what we call depression. And chances are, if you don't want to feel that anger, you also don't want to feel the hurt that lies beneath the anger. That's the tricky part. Beneath every anger, there's an experience of hurt. So you don't want to feel your anger. You don't want to feel your hurt. Now you have two walls and your emotional energy then bounces back and forth between don't want to feel my anger, don't want to feel my hurt, don't want to feel my anger, don't want to feel my hurt. And it gives you this kind of wired up bouncing feeling. And that's what we call anxiety. It's this ungrounded experience of having your emotional energy trapped between the places that you're refusing to go inside. So where does panic come in though? Because as we know, panic attacks are a symptom and a common occurrence when you're dealing with acute generalized anxiety. So what happens is if you're already operating in this baseline state of anxiety, you've already got these two walls, and life throws some really stressful situations your way. Maybe someone you love gets sick, maybe you lose your job, you have some kind of crisis. You're already anxious and you get handed a deadline or a diagnosis or something like that. And what happens then is that the bouncing energy speeds up because there are even more walls and even more places inside you that are off limits because you're even more scared and you're even more angry about whatever is going on. So the internal energy speeds up and it's rebounding back and forth off the internal walls very, very quickly. And that's what we call panic. So if you've ever been there, if you ever had a panic attack, then you know panic is not pleasant. Panic is tough to deal with. And of course, you want to feel better, or you just want to feel a little less bad. You want to be able to function in your daily life and not be hyperventilating in your closet all the time. So chances are, if you reach for something to take the edge off that feeling, you're not trying to hurt yourself. You're not really trying to hurt others. You're not trying to get addicted to drugs or a compulsive behavior. You're just trying to find a way to cope. That's it. Also, sidebar, my cat has decided to photobomb this Facebook Live. So if you see her wandering around in the background, forgive me. She is a rowdy kitten. She cannot be contained. So the good news about anxiety is that when you allow yourself to learn how to feel those off-limits emotions, you can start to heal. Because when you are able to feel them, you don't have to put up those internal walls. Your energy doesn't have to bounce frantically back and forth, and you no longer have to live with this chronic state of anxiety. Of course, this is easier said than done. Many of us have not been taught how to feel our own emotions. It sounds so basic, but this is something that for many of us, our families actively discouraged us from feeling how we felt. There was denial, there was minimizing, there was all of these things that discouraged us from feeling how we felt. So at the beginning of this journey, it's especially important to get the help of someone who is compassionate, someone who's well-trained, someone who's willing to sit with you and teach you to offer kindness to yourself. And of course, we recommend a professionally trained therapist in this case, if at all possible, someone who can teach you to become your own counselor. It's kind of like when you go to the Red Cross to get certified in first aid, you have a professional teach you how to treat the injuries, right? Before you treat them yourself. And counseling and therapy is kind of like that with emotional work. It's getting an expert to show you how it's done first. And if you do this emotional work, if you learn to give yourself that kind of emotional first aid, you will sense that your felt need for addictive substances or compulsive behaviors really decreases dramatically. It's exciting, really, how it happens. And that's part of why we love what we do. We get to help people do this amazing work every single day. So, bringing it all together, long-term recovery from addiction and from substance abuse means addressing and healing the underlying core issues and the reasons why you started using in the first place. It's fascinating. They've done studies of rats who you put the rats in a cage in an environment where they're unhappy and they're alone and they're isolated, and they always want the drugs. They'll always elect water that is laced with drugs and chemicals. But if you put the rats in an environment where they have friends, they have connections, they have purpose and meaning, they have all the things that make rats happy in their rat lives, then they don't want drugs. They don't want to check out. And this is a study by Bruce K. Alexander, brilliant researcher. And the overarching point is that if you're happy, if you're fulfilled, if you're content, you don't want to check out of your life. It's true for rats, it's true for people. And so when we look at that underlying discontent, we can really transform people's lives and have them become free from the addictive behaviors. So again, give yourself the tools and the support that you need to work with the feelings that you've held at bay. Everyone is different. Maybe for you, that means going to outpatient therapy. Maybe that means choosing inpatient treatment for residential care. That's what we do. Everyone is different, but no one should have to do this by themselves. Nobody. And lastly, if you're afraid to try and you're afraid to feel your feelings, then I get it. But I will offer this to you. You are stronger than you know. You are. You don't have a feeling that you don't have the strength to bear. And now I just want to check out the comments really quickly before we sign off, make sure I didn't miss anything, because I know a bunch of folks are watching live now. So thank you for your likes and comments. Really appreciate you and your viewership. Okay, Greg says, how do you know if you have a problem? What are the symptoms? Well, anxiety, as with any mental health condition, you know you have a problem when it interferes with your daily life functioning. So like at the quote I read at the beginning, someone who really struggles to do the basic life maintenance tasks, or on a higher level, someone who really struggles to get through the day and feel positive and feel present or happy to be alive. Anything that's between you and the person that you want to show up as is a problem that you need to address. But when we're looking at diagnostic criteria, it really is of the sort that interferes with your daily life functioning. All right. Thank you all so much for listening. It has been a pleasure to speak with you today, and enjoy the rest of your Thursday. Thank you.